If scoliosis pain is messing with your sleep, your energy, or your focus, this video will show you exactly what to do to start feeling better today. I'm Mirenzi, a physical therapist and Chief of Research and Communications at ScoliCare. I work with patients, families, and clinicians worldwide who want to manage scoliosis pain without jumping straight to surgery or waiting until it's too late. One of the most common things I hear from patients is, "I've been in pain for months and no one can tell me why." Or worse, they told me just to wait and see if it gets any worse. And that's heartbreaking, because when scoliosis-related pain shows up, it's not just a physical issue. It affects your sleep, your ability to concentrate, your mood, and your energy. It can make everyday activities like sitting at your desk, walking the dog, or picking up your child feel 10 times harder than it should. The problem is scoliosis pain is often misunderstood. People are often told it's normal or that there's nothing they can do unless their curve gets severe enough for surgery. But that's not the full story. In fact, many of the patients we work with are dealing with pain that isn't directly caused by the curve itself, but by the imbalances, the compensations, and the way their body is working around it. And here's the good news. That kind of pain can be managed. But before I show you how, we need to understand what's actually causing it. Because once you understand the source of your scoliosis-related pain, it becomes much easier to reduce it, and in many cases prevents it from flaring up again. What I'm going to share with you now is based on what we see every day in clinical practice, backed by current research and supported by the outcomes of thousands of patients we've worked with at ScoliCare. These aren't just generic tips you'll find in a quick internet search. They are specific to how scoliosis behaves in the body and why a targeted approach is so important. When someone experiences pain related to scoliosis, the first assumption is often that the curve itself is pressing on something and causing damage. But in most non-surgical cases, that's not exactly what's happening. What we've found is that the pain is usually coming from something more subtle. Imbalances in muscle tension, strain on certain joints, and the body working overtime to compensate for the uneven posture created by the spinal curve. Let me give you an example. When the spine curves even slightly, the body adjusts. One shoulder may lift, one side of your back may tighten, your hips may rotate just enough to throw off your center of gravity. And you might not even notice these shifts at first until the muscles that are working too hard start to fatigue or spasm. That's when the pain shows up. In many adults, this kind of pain builds over time. It's not how big the curve is, it's about how your body is handling it. What's encouraging is that these issues are treatable. With the right guidance, we can target the muscles that are under stress, restore more balanced movement, and support your posture in a way that brings the body back into alignment, at least partially, and often that's enough to significantly reduce pain. This is the foundation of how we approach pain management at ScoliCare. It's not about masking symptoms. It is about understanding where the discomfort is really coming from and giving your body a chance to reset. Now that you understand what's behind most scoliosis-related pain, let's talk about what you can do about it right now, today. Because long-term management involves a personalized plan, sometimes including bracing, rehab, or both. And there are immediate strategies that can make a noticeable difference in your comfort level. These are the same tools we teach in clinic that we share with practitioners around the world. They're safe, practical, and focused on helping your body feel more supported and less strained, starting with small changes you can control. One of the simplest places to begin is by exploring what we call a postural relief position. This is a supported lying position that helps your muscles relax and reduces spinal tension. For some people, it's side lying with a pillow between the knees, and for others, it's lying on your back with gentle support under the knees or lower back. These positions help shift the load away from overworked muscles and can often help bring relief within just a few minutes. But beyond passive relief, we also want to activate and retrain your core, the deep stabilizing muscles that help control movement around the spine. When these muscles work better, your posture becomes more supported from the inside out, which often leads to less pain throughout the day. One of our go-to movements for this is the bird dog. You've likely seen it before, but when we use it for scoliosis patients, we take a more intentional approach. We ask the patient to move slowly, keeping the spine steady while reaching one arm forward and the opposite leg back. The focus here isn't on how far you reach, but on how well you control the motion, especially preventing any rotation through the pelvis or spine. We even coach the patients to think about elongating their spine as they move, creating length and control through the core. Another excellent option is the dead bug exercise. This is a supine exercise, which means lying on your back, where you move your arms and legs without letting your back arch or twist. In this exercise, you slowly extend one arm and the opposite leg while keeping your lower back still. The goal is to move with control, not speed, and to maintain stable, neutral spine throughout. And even a few minutes a day of these types of movements can begin retraining your nervous system, improving muscle coordination, and reducing postural strain that drives a lot of scoliosis-related discomfort. And here's the key. These exercises aren't about building big muscles, they're about creating a sense of stability and ease in your body. Scoliosis pain doesn't have to define your day. With the right strategies, ones that are clinically tested, safe, and tailored to how your body actually works, you can start feeling better. And that change can begin today. From all of us here at ScoliCare, thanks for watching.